We do this on Wednesdays. We talk injuries with one of the experts from OrthoCincy's. The great thing about OrthoCincy's is you never need an appointment, and they have specialists and locations across the tri-state offering walk-in orthopedic urgent care during the week from 9 a.m. to 9 p.m. and on Saturdays from 9 a.m. to 1 p.m. at Edgewood and Anderson. It is easier than an ER. It's much cheaper than an ER. You can learn more at OrthoCincy.com. That's OrthoCincy.com. Dr. John Fritch from OrthoCincy's is with us. I want to ask you about Billy Price's retirement, the former Bengal, and we'll do a few minutes on Emilio Pagan. But let's begin with an unfortunate injury if you're a fan of baseball, and that is to reigning NL MVP Ronald Acuna, who tore the ACL in his left knee on Sunday. It's the same injury that he suffered in his right knee 3 years ago. What's interesting to me about this is after the game, he's talking with reporters on Sunday, and he said, well, it doesn't feel very painful. And he said, quote, I don't think it's that bad. Is this sort of a common thing where, someone might say it's not all that bad, and then you find out it's, well, a type of injury that's going to keep a guy like Ronald Acuna out of action for quite a while?
Yeah, it's pretty interesting, especially since he's been through it before on the other side. Each injury is a little different. There can be some associated injuries with it. So with an ACL tear, you can get some bone bruises, which are painful. You can get other ligament tears or meniscus tears. So it's possible the injury was a little different and less severe. Also, this was shortly after he injured the knee. Before probably the swelling and everything else set in, he may still have some adrenaline on board, and it just wasn't hurting him quite as much. And maybe some of that's psychological. He wasn't quite ready to admit that his knee was injured yet.
Is there a way to know almost immediately if the ACL is torn versus if it's sprained?
Yeah, and so usually you can physically examine these patients, and they'll feel unstable if the ligament's torn. Now, that can be a little difficult to do. While it's painful, people tend to tense up, and it also swells up, which can make it difficult to examine. And so the definitive way we take a look is with an MRI, which can tell us once and for all if the ligament's torn or not.
Walk me through the process here. Surgery, rehab, recovery, possible complications, and whether or not the beginning of his 2025 is in jeopardy too.
Yeah, of course. So, as we know, lengthy process. We saw it with Joe Burrow. We've seen it with a lot of athletes over the years. Begins with a surgery. Usually we like the surgery to happen relatively soon. So it doesn't have to be immediate the next day, but after a few weeks, once you get the swelling and motion improved, then it's probably an appropriate time to operate. We go ahead and do an ACL reconstruction, where usually we borrow a tendon from another part of the body and make a new ligament. Afterwards, the recovery is intense. And so especially for a professional level athlete that has all these resources available to him, it's very likely he'll go to a rehab facility, work with doctors and physical therapists that they focus on that 24/7. Starting out less intensive, working on getting his motion, and then as things progress, getting his strength back. Then at about the 3-month mark, doing more sport-specific exercises. Earliest return to play, looking at 9 to 12 months. So in terms of his spring season, this may affect it. He may not quite be ready for the return then.
Dealt with a torn ACL in his right knee in 2021 and now a torn ACL in his left knee here in the early summer of 2024. Is that just an unfortunate coincidence, or is this maybe the sign of something deeper, where someone like this is more prone than others to injuries like this?
Absolutely. So it's a pretty well-known fact that people that get ACL tears are at risk of re-tearing the same side, and even at higher risk of the average person of tearing the other side. And so it's probably the right combination of his own general anatomy, the sport he plays, the way he moves, that has just put him at higher risk of tearing his ACL. But you did well with recovering from the first one, so the hope is he does with this one as well.
Let's talk about a member of the Cincinnati Reds, Emilio Pagan, a right-handed pitcher who came out of a game dealing with right triceps discomfort. He has since been placed on the injured list. The good news is he has already started throwing, which I guess would suggest that his timeline is not going to be as long as maybe we originally feared. Let's go back and review, because I think a lot of people hear triceps but don't necessarily know what it is or what it does. What is the triceps, and how does it work in relation to other muscles?
No, of course. So triceps is the big muscle on the back of your arm. It helps to extend your elbow, so it's the main extender of your elbow, or essentially it straightens your arm. So obviously it's a pretty key muscle for pitching and throwing.
Is pain in the triceps sign of something that could be more severe, or is this simply treated as, look, it's isolated pain and it's dealt with rest and recovery, and you're going to be able to be back in time pretty quickly?
Usually difficult to say, and so they've obviously done an MRI on him already, and they didn't really show anything like a ligament tear or anything more severe. So I suspect this is hopefully something minor that with a little bit of rest and time is going to get better, and we're going to see him back in the game.
I want to ask you about a former Cincinnati Bengal. Folks remember Billy Price from Ohio State, taken by the Bengals in the first round of the 2018 draft. He is retired. It was with the Arizona Cardinals. He's retiring because of blood clots. Now, that's not the sort of thing you hear about with professional athletes on a regular basis. He had pulmonary embolism surgery, which we could talk about what that is, and it was determined that he ran the risk of internal bleeding while on blood thinners, that, you know, that the risk was not worth the reward, I guess. Let's talk about blood clots. What causes them and how are they detected?
Yeah, so very crazy thing to happen to him, but these do happen. Blood clots essentially is your way, the body's way of stopping bleeding. But sometimes it can inappropriately happen within your vessels or within your lungs, like it did with him. How are they detected? So usually we see that there's swelling of body parts. There can be difficulty breathing, which can be really concerning in the case of getting a clot in your lungs. For detecting a clot in your legs or arms, we usually use an ultrasound to take a look at the vessels, and you can actually see a block in the flow. And then when it comes to lungs, usually a CAT scan with dye in your veins or in your arteries to see where that blockage is.
So you hear about blood thinners. I guess with blood thinners, he ran a certain risk here. How are they involved with this?
Yeah, and so blood thinners are primarily designed to thin out your blood, obviously, as the word implies, to prevent it from clotting again. The biggest thing is once you already have a blood clot, you don't want it to get bigger. You don't want it to cascade into more blood clots, and so that's why we place people on blood thinners, usually for around a period of 3 months, but it could be longer. Problem with that, if you're playing a contact sport, is that it puts you at higher risk of bleeding, obviously. The things that normally wouldn't cause you to bleed may cause you to bleed. And so we see this in patients a lot. You bump into something or even small touches or a pat on the back cause a big bruise. And obviously in a sport like football, the head-on trauma, it can cause something more serious like a bleed in your brain or elsewhere.
So he can't play professional football. Does he face other day-to-day restrictions as he goes about his life post-football?
It's unclear right now because it hasn't been very long since his blood clot. Yeah, he's going to have some restrictions now, depending on what risk factors are at play. So people that get blood clots, sometimes there's some things that predispose them to it, like hereditary factors, clotting disorders. Those people are at higher risk and may need to be on blood thinners for a longer period of time, but it's possible that he is able to come off of blood thinners and then his activity restrictions will not be as definite, and hopefully he can return to some level of activity.
There you go. Great insight from Dr. John Fritch from OrthoCincy's, Orthopedics and Sports Medicine. We say this every week. The great thing about the people at OrthoCincy's is they have specialists and locations across the tri-state, including walk-in orthopedic urgent care during the week from 9 a.m. to 9 p.m. and on Saturdays, 9 a.m. to 1 p.m. Edgewood and Anderson. Took my daughter to the Anderson location. It is easier and cheaper when she broke her foot. Easier and cheaper than going to an ER when you have an urgent orthopedic injury. Just go to OrthoCincy.com. That's OrthoCincy.com. Reds.